One of the things about the medicine we practice is compared to modern medicine is we normally don't have so much life-saving type of interventions. That's one of the things that makes modern medicine so powerful, is the ability to snatch life out of the jaws of death. And we don't seem to have that as much capacity with that with Chinese medicine. But, you know, an ounce of prevention is worth a pound of cure. There's a lot of things we can do with the medicine we practice that can really prevent bad things from happening. Now, in this section, I want to go over some special considerations. And what I mean by this is special considerations that have to do with elderly patients that are somewhat different from other patient populations. The one thing is most authorities will talk about kidney deficiency, kidney yin deficiency, especially Jing deficiencies. But I would say that deficiencies are relative. And what I mean by that is, although elderly patients often present with overall Qi and Jing deficiencies, these conditions can greatly complicate treatment in other age groups, but it is not always true in the elderly in whom these type of deficiencies are really more the norm of aging. So while tonifying, especially yin tonification, is helpful, it is not as necessary when treating the elderly to tonify before addressing other imbalances, such as Qi and blood stagnation, for example, in symptoms involving pain. Another special consideration, one of the very most important, is check medications. No other age group is as routinely over-medicated as the elderly. It's really a tragedy. Make sure you ask about the medications your elderly patients are taking and encourage them to speak with their pharmacist and doctor if you suspect there may be problems of drug interactions or over medications. Suggest their caregivers consult with their pharmacist for drug dose compatibility advice. And I'm standing here looking at John Chen as a pharmacist. I'm sure he'd agree with that. A pharmacist can be one of the most important partners in managing elderly care because they're a fantastic resource to go over any kind of complications or problems with the medications. It's a significant problem what happens with medications in the elderly. Another special consideration I feel strongly about is using touch therapy. Many elderly patients, especially widows and widowers, have gone years with little or no gentle, caring touch. So in addition to acupuncture and herbal therapies, spend some time employing touch therapy, regardless of the condition your patient has seen you for. Even a few minutes of doing a bit of a back massage can help your patient reconnect with their bodies and remind them that they are still worthy of human contact. Communicate with family and caregivers. Communicating with patients who have memory loss and or dementia can really be a challenge. When treating such patients, include family members or other caregivers, both when gathering history and in giving recommendations. Be sure you have a patient sign a release that gives you the authority to communicate with others about their care. Nowadays, in days of HIPAA, you really need something if you're dealing with a caregiver, a daughter, a relative, whatever, somebody that brings them in. If you get into talking in details about their care, you really should have a release form signed. Another related consideration is hearing loss. Patients with hearing loss can present challenges, especially those who have trouble admitting to themselves that they have hearing loss, have lost hearing capacity, and refuse to wear a hearing aid. Many of these individuals have become accustomed to not hearing or to only hearing part of what is being said, and they may not ask you to repeat yourself. So look for signs your patient may have hearing loss, and if so, speak in a louder voice and get confirmation that your patient has understood you. I've been treating elderly patients for so long, I tend to speak in a loud voice all the time now, but that's something to watch out for. Another thing to watch out for, of course, is bruising. Because while patients of any age can experience bruising after acupuncture or acupressure, it's far more common in the elderly, especially a lot of elderly on blood thinners. It's a good idea to have some sort of informed consent statement alluding to this and stating that it is not a cause for concern. I learned the value of explaining this only after getting some calls from elderly patients who were worried that something had gone very wrong when they found a bruise the day after receiving acupuncture. So you don't want them stressing over that. It's best to let them know up front that may happen. It's nothing to worry about. Another thing I highly recommend that you give special consideration to is that you don't rush your patients. Our fast-paced society contributes to the frustration elderly people feel over their diminished capacity and being a burden to others around them. So allow extra time in your schedule for your elderly patients so they won't feel that they are slowing you down during their treatment time. A good thing to do is schedule these patients during the slower, like late morning or early afternoon times. You know, most people that are working, they want to come in, you know, either early morning or at the end of the day. So that, for most practitioners, that means their later morning to early afternoon schedule is a little bit slower. And that's really the best time for most elderly patients to be seen. This also helps in that if your elderly patients are driving, that they won't have to deal with so much traffic. And one of the things that can really be an issue for those who are still driving is in the twilight hours, in the end of the afternoon, as the sun is going down. They tend to have much more vision problems, so a lot of them will get very stressed out if they're going to be on the road at that time of day. And then, of course, maybe the biggest special consideration in my book is cost. Many elderly patients have serious financial limitations, so consider giving them a substantial discount for this group and let them know but make sure you let them know what you normally charge. If a higher number of treatments are needed, try offering some at no charge or a greater discount. The biggest challenge you'll tend to have, though, is convincing such a patient to take you up on this. You know, you may think if you're giving away treatments or something, people will jump on it, but actually people, and especially the elderly, will maybe not take you up on it. They'll feel a little awkward. They don't want to be given charity. But depending on just what type of demographic of elderly patients you're treating, you literally may have patients that are trying to decide whether to come to you or pay their electric bill or pay their food bill. So there is no Medicare coverage yet. We hope to get there, but so please give every consideration to that. But speaking of that, some states may not allow discount for different age groups. So check to see if this is the case in your state. If you belong to a state Oriental Medicine and Professional Association, they may be able to help you with that. If you find out that discounts for age groups aren't allowed in your state, you should be able to get around that by having a written policy regarding how you charge based on the time that you spend. As elderly patients often need less time of needle retention, a discount can be justified. Not only do they usually need a little less time of needle retention, but sometimes it will be difficult for them to stay in any one position for too long. So to keep them comfortable, you may have to do a little less needle time too. So you should be able to justify some kind of discount by having a policy that says, because we spend less time on the elderly, we can give them a discount and still be legal. Now we're going to get into specific conditions. Compression fractures, of course, this is most common in female patients with underlying osteoporosis. The first case of compression fracture I ever treated, I was not very confident in it. I thought, my goodness, it's not like the acupuncture is going to make the fracture go away. But I was pleasantly surprised to find that it was very helpful in controlling the pain. And I've seen many, many cases of compression fracture since then. We're usually here talking about, although I don't like to stereotype, but in my market anyway, usually talking about little old ladies in their late 70s, early 80s that maybe have quite a bit of wasting and things like that. So it's not an easy type of patient logistically to accommodate in the practice. But actually, I found a pretty high success rate with at least bringing the pain, giving substantial pain relief. Now, I like to use local points, and that's kind of my thing. You're here, of course, going to be talking mainly about along the spine, compression fractures in the vertebrae. So local points around the area of the fracture, governing vessel points, bladder channel points. Of course, you can also use kidney chi tonifying points such as GV4, bladder 23, corresponding auricular spine points. I definitely like to use heat, and Moxa could be used. I use Tdp lamps just because my practice is quite busy. I don't have a Moxa slave, so Tdp lamps are a way for me to do a nice, gentle warming therapy and do it in a way that's time effective for me. You have to have the low to modest setting for the Tdp lamps, and the temperature settings for Tdp lamps, we're really talking about the distance away. So you might want to put it a little bit further away than you normally would. And then using some nice acupressure massage techniques, maybe rubbing in a good herbal liniment. I definitely like to use herbal plasters for compression fractures, but there you have to be careful. It's one of those things of self-care when you instruct a person to do this themselves between the treatments. These plasters are so helpful, but there is a risk of some skin problems. So I highly recommend that if you're using really anything you give a patient to do at home, you should have, if not have them sign off on an informed consent, you should at least you should give them a handout that explains how to manage this home therapy, what the potential risks are, what to do if there's any kind of complications, and then make a note in your treatment charts, either that they signed the informed consent or that you gave them the handout. So herbal plasters are fantastic, but you really do have to educate about the potential for some skin problems there. People with sensitive skin will have more problem. The number one thing you need to tell people is if they're using a plaster especially, or even liniment, that they should not put more on if there's any skin irritation. If you especially with a plaster, if you take a plaster off and 3 or 4 hours later there's still some irritation on the skin and you put another one on, it's just going to really make it mushroom and make far more irritation. So if you're dealing with an elderly person that has dementia or something like that, and you're not confident in the caregivers of taking care of that, unfortunately you might have to leave the plasters off. The tricky part of this treatment is positioning, because some patients you may be dealing with very frail patients. If they're not able, I normally, for treating the spine, I like to use one of the body cushion pads and having people lay face down. Sometimes I'll do laying on their side. But for some elderly patients, you're not even going to be able to get them laying on their side. One position that you can do with using local points here, that you can do for treating this sort of problem, is to have them sit like maybe at the foot of the table or somewhere along the table using some pillows, and then have them lean forward with the gown off the back so it exposes their spine so you can get to that spine. Sometimes that's the best you can do.